of Sip and Learn. A massive shout out to Unomaka, my sister from another mother, who came up with this lovely name. It's a Sip and Learn, because Minanawe, we are sipping on coffee. If you're not a coffee person, grab that tea. If you drink your green tea, that's okay. If you like sipping on your rooibos, do just that. But I'm having my afternoon coffee, and this conversation is about to get very fruitful. Namhlanje, in case you are wondering, sizobe sikhuluma with Dr. Siyanda, who is from #KeReady. Mina ngiyathanda ukufaka hashtag because they always walk around with ama t-shirts abhala ukuthi #KeReady, baphinda bathi #ngiredi. If you haven't followed them across all social media platforms, they are at KeReady SA. And njengamanje sizobe sikhuluma with Dr. Siyanda, and in case you have some questions, you can always drop them on the comment section. So this is attender with our session esobanayo, and namhlanje sizobe sikhuluma about stroke in the young population. My beautiful doctor, you can request Ariyeng. Guys, I hope you've grabbed yourselves a cup of coffee, because I'm really excited about eswabiza ngokuthi Sip and Learn. My goodness, ngilithanda leli gama nomaka. Okay, so we are sending her an invite.
Hi.
Oh, hey, Doc.
How are you?
I'm okay. How are you?
I'm good, thank you. Happy New Year.
Oh, the same goes to you. Thank you so much.
Oh,
No, I'm saying that kanti umuhlanje umusendlini ufaka iduku liyakufanela, giving makoti
I have to do it
vibes.
at some point. Thank you so much.
You're welcome. So, standard procedure, you know how it goes. How are you? How was your day? What were you up to?
No, I'm well. Thank you. My day was pretty relaxed, meetings, preparing presentations. Yeah, just planning and then preparing for tonight as well. So pretty relaxed day today, fortunately, yeah. How was your day?
Relaxed.
I wasn't out there driving somewhere, running around. Yeah, I spent the whole day indoors.
Oh,
Yeah.
okay.
Yeah.
But it sounds
Yeah, it was very
productive. It really does.
productive.
Well, if you ask me about my day, sure, I think it was very slow, hey? Hence, interview. Like Melissa Kalemo 6. Here I am setting up the last minute. No, but I had a pretty chilled day. Thank you for asking.
No, no problem. Yeah.
Right. So let's get straight into it. In case kukhona oyibuzayo njengamanje ukuthi who is this gorgeous queen in front of us? About Dr. Siyanda. What is she all about? Ukhulelephi? Thatha isibeke.
Okay, so Siyanda Mgangato is Bogo from the Eastern Cape, but now residing in Durban. So I'm from a small town in Matatiele. Yeah.
Oh,
Yeah. But now residing in Durban, working for KeReady. I'm one of the young doctors there. So there's 3 of us in total in KZN. Hopefully you will meet the other 2 brilliant doctors as well sometime.
wow.
Yeah, so I enjoy public health. So going out into communities, finding out what causes health issues in communities, in young people, trying to assist with those problems, and health education as well. So I'm quite big on that. And I'm sure, as you can tell, I'm a very relaxed person, chilled person, and calm.
Yes, you are. Yes, you are. Khona into peaceful ngawe nje. Ngathi ngangakubuza lutho athi ngakulalela ukhulume nje.
I know, thank you.
So I spoke of KeReady when I was still introducing you. So do you want to take us back? KeReady, when was it established, and what is the
Okay,
aim and purpose?
So KeReady was established during COVID, when COVID started, so in 2021. To the aim
Mhm.
back then was to educate on COVID-19 and the safety of the vaccination as well when it came out. So it was mainly online. And then also after lockdown ended, it was to help young people, get back on their feet, help with job opportunities, finding those opportunities, encourage them as well, to recover from the lockdown, and then it evolved.
Mm.
They saw a need for advocacy for the COVID vaccine, because we saw that young people were not really keen on taking the vaccine. And I think there was this notion or stigma that as a young person, I'm healthy, I don't need the vaccine, I'll just take my chances
Mm.
with the virus. So that's when we came in with the health education, education on COVID again, on the vaccination, and then also having mobile units going out into the community offering COVID vaccination as well. But then not only COVID vaccination, there are other services that we offer. And we have now found that
Okay.
there's a high need for sexual reproductive health related services, so your contraceptives, HIV testing, your PrEP, and health education around that. So we very much
Mm.
focused on that. So our focus is the youth, but we are open to other age groups as well. We also do growth monitoring for young children below 5 years, should a mother bring their child as well, because that's also another huge issue. Um, so yeah, so that's where we are now with KeReady. So we also on other platforms, our social media as well, doing TikTok lives, doing radio interviews, which is how I met you. Yeah, so
Hey.
so yeah, we're quite vocal, quite out there, trying to encourage people to take charge of their health, to encourage young people specifically, because you're young, but that doesn't mean that you don't need to take care of yourself now.
Amen.
Yeah.
Amen. I love that. So our main topic namhlanje sukhuluma about stroke in the young population,
Mm,
as you mentioned, ukuthi nitargeta educate kakhulu youth and raising awareness. So let's talk about stroke in the young
mm,
population, because ukubona youth ithathe ngathi stroke
yeah.
akusisona sabantu abancane, it can only happen to
Mm.
abantu abadala. So educate us. What is a stroke and what defines young
So
stroke?
a stroke is when there's interruption to the blood supply that goes to the brain. So there's two different types of strokes. You can have an ischemic stroke where it's usually a blood clot. So it blocks the vessel and then no blood gets to the brain or that particular area of the brain, or a hemorrhagic stroke where the blood vessel bursts for some reason and you bleed out of that vessel, and then still not enough blood is getting to that particular area of the brain, and then it results in death of the cells supplied by that vessel, and then dysfunction of that piece of the brain, which is then you will see the manifestations physically. So a young stroke is a stroke that occurs in young people, so between the ages of 18 to 55. Yeah, so
Sure.
essentially, yeah, that's the distinction.
Sure.
Yeah.
Wow, that's very informative. Thank you. So what puts someone at risk for getting a stroke when they are still young?
So there are a number of things. Most of them are related to lifestyle. So at the top of the list is your smoking, alcoholism, as well as obesity or a high BMI. So a BMI would be your weight related in relation to your height. And then we also have your chronic illnesses, hypertension, diabetes, high cholesterol levels. These are not things that only affect older people. We have seen 35-year-olds with hypertension. We've seen 20-year-olds with diabetes, and then also contraceptives use as well. The oral contraceptive pill as well can contribute to the risk of having a stroke.
True, hectic. So,
Yeah.
so you mentioned something about the height in it.
Mm.
Can you maybe just like elaborate on that?
Okay. So I was talking about the BMI, so how we determine if a person is of the right weight, or they obese or they are overweight. So we take your
Okay.
weight in relation to your height. So if you're someone of a short stature, obviously we expect your weight to be on the lower side because you're all short. If you then have a higher weight but you're short, it means that you might possibly are overweight or obese, so you have too much weight for your stature. And then if you're a taller person, you can get away with having a bit more weight. So that's how the weight relates.
Got you there, got you there.
Yeah.
Ngiyabonga incazelo. And another one that seems to be trending a lot with Ishusha. That's Ishisha, no Ishusha, but a habli. What are the risks?
E,
Is it as risky as
sorry,
smoking
what's
a
that? Are you
cigarette
saying
or
are you saying Habli?
yes, habli?
Oh, yes, yes. So the risk of Habli, okay. So not many studies have been done on it, but it's becoming quite evident that it is quite dangerous. Um, Possibly more dangerous than smoking cigarettes. The contents of Habli are toxic minerals to the body because it does contain tobacco like cigarettes and then also other types of minerals that you shouldn't be having in your body. And just like cigarettes, those things
Oh,
do get into your bloodstream. So I think they did say that smoking habli for 1 hour is equivalent to smoking 200 cigarettes. So it's like consuming that amount of smoke, so it's quite
what?
dangerous, and there's been cases reported of people suffering from health conditions really because of the hably smoking. And you can also have long-term effects that are similar to cigarettes as well, like your cancers, your skin problems, so it's quite dangerous, I would say. Yeah, so
Yeah.
high up there, if
Yeah.
not higher than cigarettes.
Hectic. Hectic. Yo, I hope ngiyabakuzonda for leli qiniso olikhipha
I
manje.
know, but it's the truth, and we hear, if you want to smoke it, then you
And
smoke
thank
it
you.
knowing the risks.
Thank
Yeah.
Thank you. Thank you,
Yeah.
Dr. Siyanda. Guys, to those of you that have just joined in, Dr. Siyanda is from KeReady. Go and follow the page now, please, at KeReady SA, right? There's no
Mhm.
underscore.
Yes, just get ready, Esther.
Awesome stuff. Okay, so guys, if you have any questions, you can also be a part of the conversation. Drop in J question on the comment section, so attender right at the end of our
Mm.
interview. Right, so back to our topic, ne? Is stroke utina, the young population. So what are the important signs to look out for when suspecting someone has a stroke?
So, to make it easier to remember, you can use the B FAST acronym. So B stands for balance. So that person will lose their balance. They might not have coordination, struggling to walk. And then the E stands for eyes. So they'll have problem with their vision. So it's usually just blurry vision. And then F is for face. So they'll have drooping of the affected side, so drooping of one side of the face. And then A is for arms, so weakness in your arm or your legs or both on one side. S is for speech, so you struggling to speak. A person might be incoherent, so they sounding very confused, and they struggle to understand you as well. And then T is for time. So once you identify these signs, time is very critical. So you need to act very fast, get that person to an emergency department as soon as possible. So other signs could then just be dizziness, as well as a sudden onset of a headache. Depending on the type of stroke, it could be a very severe headache, and then passing out soon afterwards as well.
Okay.
So yeah.
Sure. Wow. And I'm sure so what if kwenzeka into eyodwa kuwona be
Mm.
fast, eh? Be fast. Makwenzeka nje just maybe
Yes,
the
yes.
arm or weakness.
Yes, then you still act, because it's not necessarily going to be all of these things, you know. So it depends on the part of the brain that is
Okay.
affected. You know, it could just be the part
Okay.
that sends signals to the face. So then it's just the drooping of the face that's then everything else is fine, you know. So, and then maybe the face is not affected, it's just the arm, you know. Yeah, so it just depends on which part of the brain is affected, so it doesn't have to be all of them at once. Yeah.
Okay. Loud and clear, doc. So is there any way, one can prevent themselves from getting a stroke?
So the best thing you can do is lead a healthy lifestyle. We, like I've said, most of the things are things that you can prevent or cut from your life. So, like, stop smoking, decrease your alcohol intake, be physically active to maintain a healthy weight as well. And then, if you have a chronic illness, then you need to make sure that it's controlled, you're taking your treatment accordingly, and you are following up. You're attending all your follow-up appointments as well. So that's the best you can do. In some cases, it's just an underlying condition that that hasn't been diagnosed yet, or maybe something that runs in the family, like something that causes issues with your blood clotting, you know, and it just hasn't kind of come up yet in you. So the best you can do is just lead a healthy lifestyle, and that's the best way. Yeah.
Amen. Amen.
Yeah.
Right. So I don't want to wrap up our interview because I feel like we have a lot to learn from you. But I'm
No
hoping to
problem.
have you again on this platform.
Definitely.
So in case in case people want to connect with you, Dr.
Mm.
Siyanda, at KeReady, how do we get a hold of KeReady, and how do we maybe reach out to ama mobile clinics in?
Okay. So you can contact us on our WhatsApp line that runs 24/7. So the number to the WhatsApp line is 060 019 0000. So you can contact us there anytime. And then you can also find out where our mobile units are by going on our website, which is www.keready.co.za, and you can search by province as well, because we're not only in KZN, and then within each province it will tell you in each district where you can find a mobile unit, and you can check that weekly or daily, depending on when you need to visit us.
Okay, right. So you guys used to have, I remember last year, every Wednesday,
Yes,
my
at
lives on TikTok. Are
7.
you back?
We are not
Yay!
back yet.
At
So
7
January,
lunch.
yeah.
Okay.
So we're not back yet. We haven't confirmed when we will be back, but it will probably be from next month. So yeah, January is a
Okay.
bit of a slow start. Everyone is still coming back slowly, slowly, slowly. But our mobile units have officially started working on the ground for this year as well. So just keep a lookout. We will definitely be advertising on our pages when we start.
Okay. At KeReady, guys. SA. At KeReady, SA. So what are you cooking in the year 2024? as KeReady? Is there anything you feel we need to know about?
At the moment, not specifically, but in our future interviews, I'm sure I'll be able to give you something. But at the moment, still sitting down, having meetings. So I can't share anything. I don't have anything yet to share that specific brainstorming stages. So in our future lives, I'll definitely,
Abathakathi are working overtime.
yeah. So, but definitely in our future lives, I will definitely have something for you. Yeah.
Yay! Thank you so much, Dr. Siyanda. This is your social media handle, ne?
Yes, yes.
So what content can we expect from your
Hey,
personal
you know
account?
what I'm discovering? I'm not a posting person. I'm a story person. So, but
Oh,
I will I will
lovely.
try.
So am I.
Yeah. So, but I think there's a lot to share from my work, and then which which will also tell you about myself. But I think there's quite a lot to share about my work. It's quite exciting. It's not the usual, office or clinical work. It's just interesting sometimes. Every week there's something
Amazing.
interesting.
Ooh, amazing
Yeah,
stuff.
yeah, yeah.
Girl, thank you so much for your time.
Thank
And
you.
whatever you are doing, do your best and God will do the
Thank
rest.
you. Thank you so much.
You're welcome. Bye.
Bye. Enjoy your evening.
Oh, thank you. You too.
Thank
Pama
you.
mina zambe kumele ngisho njalo, but anyway.
It's probably just the life. I know you're always very warm and friendly.
Oh, thank you. Stop it. I like it. Now get out of here.
All right. Thanks. Thanks.
Bye, girl. Bye.
Bye.
Guys, that was Dr. Siyanda. My goodness, so insightful, so informative. I'm just hoping to have her every single Wednesday. Okanye anyone from KeReady. If you haven't followed their page, please head over at KeReady SA. Go and follow them right about now. Kuningi ozokufunda. Hello, Manels. Signing out njengamanje. But what I will do is save this live and I'll also post it on my YouTube channel. Miss B, that's the name of my YouTube channel. I might change it to Sip and Learn. Okay, guys, bye for now.